Hello. Yes. So ours is the last session, Saturday, last session. I know one must be so tired, but still we will try to make it interesting. Okay. So word rounds, you have, I think, 40 marks for the word rounds out of 400. So it's a significant session in examination. So we will start with this first. So, and we will try to make it interactive. So what's the name of this splint? Who has a mic? Please stand up and answer so that the others can listen and it will be helpful for the others. Who has a mic? Just raise the hand. Yeah. If you don't know answer to this splint, then you will not pass in your exam for sure. Okay. So tell me this, how many pulleys are there? There are this one picture and there is this two pictures that I have put. So tell me these, how many pulleys are there, and these pulleys now, what are the uses of these pulleys? So this is number one. So this pulley is for what?
Sir, number one pulley is for foot drop.
Foot drop. Okay.
The second one is in the line of the femur. So it is used when there is femur shaft fracture.
Femur shaft fracture, line of the femur, right? Then
And,
this
three is when there is tibia fracture.
along the line of the
line of the tibia.
Tibia, right? Correct. And what is this pulley for? This is this pulley is for what? Now there are four, right? This is for foot drop. This is along the line of the femur. This is for the shaft tibia. Then this is for what?
So for
give a mic to someone else who wants to answer.
One is for upper tibial traction, and one the superior is for the distal femoral traction pin.
Distal femoral traction, right? So that is basically for the supracondylar femur fractures that you gave it. Correct. Okay. So now the uses. So the uses for this is, first is immobilization and reduction of the fracture. The second is a traction to maintain the reduction. Then dressing, wound care. It is also used for the rest in case of cellulitis, soft tissues injuries. And it is ambulatory as compared to TT splint. TT splint, disadvantage of this is like it is non-ambulatory. We cannot Bowler transfer. With TT, we can transfer the patient. So that is a basically disadvantage. What are the KS that we have to take when we apply TT Bowler-Brown splint? Anyone who wants to answer that? Raise your hand. No one wants to answer it. No one has read it. Okay, so the most important thing that we have to take care now, it is the compression of common peroneal nerve. So to take care that, we should not keep the limb into an external rotated position. So that is what we have to take care. It should not be in externally rotated position. Then we have to check for the pulses, distal neurovascular deficit, that we have to regularly check up. Then we have to check for the pin tracks, because now we will be putting the skeletal traction. So we have to check for the pin track infection if it is there. Then the quadriceps, and they will become wasted because of the non-ambulatory status. So we have to make sure that they are doing the static quadriceps exercises. So these things that we have to take care. Okay. So that is, we have already discussed this, the pulley. Okay. So now you must be already, yes. The name is Thomas Splint. Okay. So tell me this, what's the full name of Thomas? Hugo and Thomas. Okay. So this splint, why he has designed this splint? Anyone? For TB knee. But why TB knee? Was there any specific reason for that? His wife was having TB. Yes, right. Good. So this is inner bar, outer bar. This is a curve for GT, 120 degrees of angle, this ring. So when you are going to, there will be only few questions asked on this. So they will ask you about this angle. Okay, what is this angle? They will ask you about how you are going to measure it. So how you are going to measure it? Anyone would like to answer? Raise the hand, and then how do you do it in your emergency? Do you do it on normal side or the affected side? Normal side. Okay. So when you are going to measure it on normal side, how you are going to measure the circumference? Where will you measure the circumference? Give mic to him. Okay. Just stand up and yes, answer.
Oblique circumference from the gluteal fold and the greater trochanter, add 6 centimeters to it, and crotch to heel length for the length of the inner bar.
Okay, crotch to heel. Do we have to add something to it?
Add 6 inches to it.
6 inches to it. Okay, so that is around 15 to 20 centimeters. Okay, and around 2 inches when we are going to circumference. Okay, so these are the two important things that they are going to ask you about this. Okay, so then uses you already know. Okay, this is for the shaft femur fractures. You will use it for the TC fracture reduction also, for the subtrochanteric fractures also, and even for the supracondylar femur fractures also. Okay, so now most important thing. So now if an examiner is cruel and he wants to take you for a ride, he will make sure he will ask maximum questions on this. Okay, so we will start with now this trolley. Okay, in this trolley now you will see inside this there will be a gauze. Do you know this gauze, this word has come from what? How this word has been come? Does anyone know? Okay, so this word has come from a Palestine. It was a Palestine city. So they used to use this fabric. So the word has come from that. Gauze has come from that. Just an interest. No one will ask you but if they ask you this, then you will get a gold medal for this. Then Gamgee. Gamgee, do you know that Gamgee word has come from name of the scientist? What is the name of the scientist? Full name, of course. Okay, so it's a Joseph Sampson Gamgee. Okay, he was a Birmingham fellow who has got invented, who has got found this Gamgee. Okay, then Macintosh sheet. I don't think so it is there, but Macintosh sheet. So who is the scientist who has invented Macintosh sheet? Don't say Macintosh. Okay. So it is James Syme who has invented it, but it is copied and patented by Charles Macintosh. Okay, basically this material was used for raincoat. They used to use it for the raincoat, and it is a high quality rubber, which is like high breaking and tethering strength, and which was a waterproof. Okay, do we have a NS bottle in it? Okay, NS. So NS, it is how much gram we have, quantity we have in NS, sodium chloride. How much is it? 0.9. Okay, right, 0.9. Okay, then what's the concentration of milliequivalent of sodium and chloride in it? What is the concentration of sodium and chloride in it? So it is 154. It is equal. It is sodium also 154. Chloride is also 154. So it is basically it gives moisturizer. Do you know how does it work? What's the principle on it works? Saline, normal saline. The osmotic effect. Have you heard of osmotic effect? How it works? Okay, so if you are not, so what it happens when it gets evaporated from the wound, its hypertonicity, it becomes hypertonic from isotonic. So what it does, it draws the fluid from the wound into the dressing. That's how it works. Okay. Then the next common, do we have a betadine? Betadine. Okay. What's the betadine is a brand name, of course. So what's the content? What's the full name of the content? Povidone iodine. What is the full its name of it? Okay, that you Google then what you did. So it's a bactericidal, and iodine. What's iodine? It is a bactericidal, and povidone, it is a carrier molecule. Okay, so it decreases tissue irritation. It causes less toxicity. It's bactericidal. It acts against viruses, fungi, sporicidal activity. Okay. So the concentration is important. The examiner is going to ask you about the concentration. So for the unhealthy wounds, how much concentration do we use? 10%. For the scrubbing, 5 to 7.5%. Okay. For the betadine gargles, how much is the percentage? 2%. Okay. 2%. Good. Then the next is hydrogen peroxide. Okay. Hydrogen peroxide. So how much is the concentration of hydrogen peroxide? 25? No, it's not. It's a 3 to 6%. We use a 3 to 6%. It's basically we use it as a de-slipping agent we use. And do you know sometimes now when we get a stain of the blood stain and everything in the wood, we remove it with the hydrogen peroxide. So how does it work? What's the principle? What does it do? Who knows it? Just raise the hand, because it's a peculiar answer. If you know it, you know it. Huh? That's what. ठीक है, it acts at breaking chromophores. ठीक है, it breaks the chemophores. That's how it acts. It removes that blood stains. Okay. Do we have a usol in that? What's the full name of usol? Okay, Edinburgh University solution. Okay, it's a calcium hypochlorite and boric acid combination. It was an alkaline solution. To make it as acidic, we add boric acid to it, and the concentration is 12.5 gram of powdered chlorinated lime and 12.5 gram of boric acid. Both are 12.5 grams. Okay, so it is in 1 liter of water, and it is a filter solution. It has to be used within 15 minutes. Okay, and whenever we are going to clean the unhealthy wounds and everything, we give a bath for around half an hour, and then only we do the debridement and everything. So what they are going to ask you in usol, it is the name. You have to know the name. Then what's the concentrate, what's the amount of both calcium, the powdered chlorinated lime and boric acid. Then the time duration. They will ask you how much time you will. It's a 15 minutes. And how much time usol bath should be given? It's half an hour. So these are the 3-4 points that you should know about it. Okay. Then do we have tincture benzoin? So tincture benzoin, how much percentage of benzoin and benzoin? What is tincture means? Do you know what's the meaning of tincture? Sorry. It's like a solution in alcohol. So it's a 10% of alcohol in 80% of benzoin and 10% of others. So that is 80, 10, 10. And it provides, we all know, it is, we use it for the adhesive properties, we use that. Then the ether. Ether, what is the ether name? What's the content basically? It's a solvent diethyl ether. Okay? It's a colorless volatile inflammant. It was an anesthetic agent we used to use, but now we use for the cleaning and removing of the dressings and everything. Sterilium. Does anyone know what's the content of the sterilium? Chlorhexidine. But what is the full? Okay, that you find out. Okay, what is the full of it? Because now we day in, day out we use it. Okay, I think Swapnil has other time. Swapnil, during wards, like this much is there. If something is remaining, then we will again. Yeah.